Hello guys, and welcome to Alpha Thalassemia, a comprehensive guide. Before we start, don't forget to click the icon below on right side and subscribe and like the channel. Alpha thalassemia is an inherited blood disorder that affects the production of alpha-globin chains, essential components of hemoglobin. It leads to reduced levels of hemoglobin in red blood cells and anemia. It is caused by mutations in the HbA1 and HbA2 genes located on chromosome 16. Alpha thalassemia is most common in people of African, Southeast Asian, and Mediterranean descent. Types of alpha thalassemia and signs and symptoms. There are 4 types of alpha thalassemia, namely silent carrier state, alpha thalassemia trait, hemoglobin H disease, and hydrops fetalis. The severity of the condition depends on the number of affected alpha-globin genes. People with silent carrier state are carriers of the disorder but do not show any symptoms. People with alpha thalassemia trait have mild anemia and may experience fatigue, weakness, and shortness of breath. Hemoglobin H disease leads to moderate to severe anemia, bone abnormalities, an enlarged spleen, and a risk of developing gallstones. Hydrops fetalis is the most severe type and causes life-threatening severe anemia and fluid buildup in the body before or after birth. Most babies with this condition do not survive beyond infancy. The severity of alpha thalassemia can vary depending on the number and type of gene mutations, as well as other genetic and environmental factors. Diagnosis. Diagnosis of alpha thalassemia typically involves a combination of blood tests, DNA analysis, family history, prenatal testing, and sometimes HPLC, high-performance liquid chromatography, method. A complete blood count, CBC, may be ordered to determine if a person has anemia and what type of anemia they have. Individuals with alpha thalassemia may have small, pale red blood cells and a decreased number of red blood cells. DNA analysis can confirm the diagnosis and determine the type and severity of the condition. Signs and symptoms. The signs and symptoms of alpha thalassemia include fatigue due to the lack of oxygen-carrying red blood cells, pale skin due to low hemoglobin levels, shortness of breath due to low oxygen levels, delayed growth and development due to chronic anemia, enlarged spleen due to the overproduction of immature red blood cells, jaundice due to the breakdown of red blood cells, and bone deformities due to the expansion of bone marrow. Treatment. Treatment for alpha thalassemia depends on the severity of the condition. Silent carriers do not require any treatment. People with alpha thalassemia trait may not require any treatment but may need monitoring. Hemoglobin H disease may require blood transfusions, folic acid supplements, and in some cases, splenectomy. Alpha thalassemia major may require regular blood transfusions, bone marrow transplantation, and supportive care. Conclusion. Alpha thalassemia is an inherited blood disorder that affects the production of alpha-globin chains in hemoglobin. It can cause mild to severe anemia and lead to complications. The severity of the condition depends on the number and type of gene mutations. Diagnosis involves a combination of blood tests, DNA analysis, family history, and sometimes HPLC method. Treatment depends on the severity of the condition and may include blood transfusions, folic acid supplements, splenectomy, and bone marrow transplantation. It is recommended that individuals with a family history of alpha thalassemia or who are at high risk for the disorder undergo genetic counseling and testing to determine their carrier status and potential risk for passing the mutation to their children. Thank you for watching and help spread awareness about genetic disorders.